Well, there are some limitations, but first of all, I think I should underline that it's a fantastic treatment in itself that really revolutionized the whole area of therapy in obstructive sleep apnea. However, there are drawbacks to the method, and the main drawbacks, I think, is just continuity and the sense of carrying a mask. Some people have problems with either dry or dripping noses or air dryness and effects like that, but overall I think the main limitation is the gadget and the device in itself that probably brings down use a bit. Yeah, that's a very tricky question. We don't know, but there's a lot of research ongoing, of course, in the area, the mechanism here that these drugs work by is extracting carbon dioxide out of your tissue. Eventually that is the main overall effect. And in sleep apnea, it's highly likely that people that run their system on a slightly too high CO2 level is overshooting a little bit in their respiratory responses. So when you have an apnea, towards the end of it, when you start breathing, you simply breathe a little bit too much and you exhale most of your CO2, and when you get rid of it, you enter a new apnea. Well, so far there is no real formal treatment developed, so I wouldn't say that we have a systematic use. There is still more research needed until we get to that point. But there are experimental studies with at least 3 different compounds, 2 frequently used antiepileptics, topiramate and zonisamide, and also a pretty well-known substance called acetazolamide. It's a little bit of a type substance in these trials, but I would sort of underline that we still don't have an extremely well-established therapy in here. There is more work needed, for sure. Yeah, well, we have clinical studies, and there are several of them. I would say maybe at least 10, 12, but most of them are small, and they are probably operative under specific conditions. What's new to the field in sleep apnea is that we have started to sort of subclassifying sleep apnea patients into different phenotypes, and with these characteristics, it's possible that we in the future can better identify good therapy candidates for therapies like carbonic anhydrase inhibitors, and that is also an ongoing work at the moment, so we are really in a very sort of dynamic period at the moment. Yeah, that is in a sense an extension to the last reasoning. So we think that it's a group of patients that we would label high loop gain individuals, which means that they're very brisk and almost even exaggerated ventilatory responses to CO2. But this has to be a remaining hypothesis, but I think we are getting closer to the point where we think this may be the mechanism in there.